Good evening, wound care gurus. Welcome to our weekly Facebook Live event tonight. I am excited to be with you guys tonight. We've got an excellent interview going on tonight with I like to say it's somewhat revolutionary in the technology that this product brings to the wound care industry. I think that you will all be very excited about what you're going to hear in our interview tonight. We are going to be interviewing from the company known as MoleciLight. They're brought to us. We have Monique Rennie, who is their Director of Scientific Affairs there. Let's bring Monique on the screen with us. Good evening, Monique. How are you?
Hello, Bill. Hello, gurus. Very good, thank you.
Excellent. Well, we are glad to have you here and with us tonight. I know that our audience is excited to hear what you have to say and what we're going to share tonight. So before we get started, as we always do with our interviewees, is how about if you could kind of introduce yourself to the audience, tell us a little about your background, what your role at MoleciLight is.
Okay, so as you said, I'm our Director of Scientific Affairs. I've been with the company since its early days on the scene. We've been FDA cleared for over a year now, so available through the rest of the world for much longer, but a little newer to the and I oversee our body of evidence, including communication of that through publications, conferences, and in methods like what we're doing now. So we can talk about quite a bit of the evidence. I'm an imaging scientist by training, and that's what I did my PhD in. But I've been very fortunate to have been in wound clinics in all over the world, and have seen the challenges that are being faced by clinicians, patients every day, and bacteria is a major.
Excellent, excellent. Well, you've got a great background, and I think, like I said, hopefully we will get some, our audience will be throwing up some questions as we go along here. But let's get into our first question, and that is, what is fluorescence imaging, and how is it used to detect the bacteria in our wounds?
Okay, so fluorescence imaging is a type of imaging that involves light. So just like you would think that an MRI is imaging that involves magnets, fluorescence imaging is an imaging that involves light, and it sees when we say that the device detects fluorescence, it detects fluorescence that's naturally emitted from bacteria and tissues within a wound. So this is a form of shining a light onto a wound,
Okay.
and then seeing the natural signals that come back from the wound. And so it's no contrast agents, and it's a form of non-invasive imaging that can be done right at the patient's bedside.
Oh, okay. Very excellent, excellent. So what types of bacteria does the MoleciLight detect then?
Yeah. So can we put up the image of the device itself so we can take a look at what this looks like?
There we go.
Okay, so here you can see the MoleciLight, how it's a handheld device. It fits in the hand or it fits in the pocket of a lab coat. And the device has two key features. The one that makes it truly unique in the space is its detection of bacteria in wounds. It detects bacteria by looking at these naturally produced fluorescent components that bacteria emit. And those are called porphyrins, which is the case of most bacteria. Or then there's something called pyuverdin, which is unique to Pseudomonas. And these bacterial species emit these fluorescent molecules, and they fluoresce red, as is seen in the image on the device. Or in the case of Pseudomonas, they fluoresce cyan. And we'll put up some examples of what that looks like. We have some additional slides to show. The second thing that the device does is it's a digital wound area measurement tool. So you can rapidly get your wound area automatically recorded, length, width, and you can also input a manual depth. And so that's designed to help clinicians with their assessment and their documentation.
Excellent, excellent. Now, does the system only detect certain bacteria? Does it detect all bacteria?
So the system detects bacteria that release these porphyrins,
Okay.
or are we a bit frozen?
No, we should be good.
Okay, excellent. The system detects bacteria that release these porphyrins, or in the case of Pseudomonas, this pyoverdin molecule. The vast majority of bacterial species do emit porphyrins. That includes your gram-positives, gram-negatives, aerobes, and anaerobes.
Okay.
And we've done extensive in vitro studies to determine what species do and do not fluoresce. And we found that 88% of the most common wound pathogens emit a readily detectable red fluorescence signal that you can see with the device.
Okay. So adding to that, or kind of adding a little more clarification, then, does it tell us, just this clinically significant bacteria, or is it also just everything that's there and insignificant?
Yeah, great. It's a great question. So we're all covered in bacteria all over our skin. Not useful to see that. So it'll be a little frightening to see that actually. No, the device detects levels of bacteria at 10 to the 4 colony forming units per gram or higher.
Okay.
And thinking on a semi-quantitative culture scale, that's roughly moderate to heavy growth.
Okay.
That particular load is important because studies have shown that bacteria at 10 to the 4 CFU per gram in wounds impair wound healing.
Oh.
And so it's well known that bacteria impede wound healing at high loads, but that's the load where the wound healing starts to be impaired. So clinicians need to start being aggressive with the bacteria when it hits those thresholds.
Awesome. Well, that's nice. That's good information to know, that it's going to focus primarily on letting you know, kind of the lights go off and said, hey, the wound needs help at this point. Now, as far as detection of bacteria, does it detect bacteria in all areas of the wound, as well as in the peri-wound, or how does it do that?
Yeah, so depending on the size of your wound, I mean, most wounds fit well within the field of view of the device, and you can capture them in a single image. For a very large wound, you could also capture a video, or you actually don't have to capture an image or a video at all. You see the signals appearing in real time on the screen. So you can pan that over the wound to see. Yeah, so it's really a real-time tool. I've seen clinicians take advantage of that real-time information by actually doing their debridement or their cleaning under the fluorescence light. So they see immediately the bacteria coming off. You can actually see the red transferring onto the gauze, with the other cleaning method that's being used.
Sure. Awesome.
Yeah. So you mentioned the peri wound though, and that's a really good point. So I think it's drilled into clinicians. You must keep the wound bed clean, wound bed prep, wound bed prep, wound bed prep. But what MoleciLight is revealing to the clinicians who are using it is that the peri wound is also a huge source of bacteria. They reside there. They often are not covered by an antimicrobial that's selected. And so you see the peri wound in many of these wounds just absolutely light up. Maybe if we could go to the slide showing some of the fluorescence. Fluorescence 2.
Lessons two. Yep. I'll bring that one up. Sure. No problem. There we go. How's that?
There we go. So the example on the left is exactly what I'm speaking about. This is a diabetic foot ulcer. And although there's some red being seen in the wound bed, what really jumps out at you is that peri-wound bacterial fluorescence. Everything you're seeing that's bright red is a bacterial load of 10 to the 4 CFU per gram or higher. And so as you debride away, you can debride away targeting that red fluorescent region, and then watch as the fluorescent signals change, as the bacterial signal decreases, or in some cases, as the bacterial signal increases, as you see more and more bacteria the deeper you debride.
Oh.
And then the wound on the right is showing a pressure ulcer. And again, you see there's bacterial fluorescence in the wound bed, but look at all of that peri-wound fluorescence all around the wound that all needed to be aggressively cleaned off.
Excellent. Good, good, good. Now we happen to get a question already that's kind of related to what we just talked about from a detection standpoint. So I'm going to throw that one in here. And to our audience, please, if you have questions for Monique, throw those in the comment section. She will be more than happy to try to answer those for you tonight. So the question is, do you still recommend that we do a swab culture or tissue biopsy type culture with this after you've done this and you see all the color in the wound?
So that really depends on the information that the clinician wants to have. If it's just a question of, is there bacteria there or not, the red fluorescent and cyan fluorescent colors on the device have a positive predictive value of over 95. And that's been shown repeatedly across multi-site clinical trials, very large patient numbers. So when you see the red fluorescent signal, you can be certain that it is indeed bacteria. Now, if you want to know the particular species that it is, or you want to know antibiotic sensitivities, then you'll definitely need to do a biopsy or a swab culture or quantitative analysis to determine that information.
Okay.
Now, what clinicians do find is maybe they'll take a sample the first time, get that information on the species, but then they don't need to go back and sample again as that patient comes in at their next visit and the visit after that, because now they can just monitor with the fluorescence over time to see how the bacteria is changing in load and location.
Okay, excellent. Thank you for that. And I just want to add something to my gurus that are listening in here, just because she mentioned a swab and or the tissue biopsy. Understand, folks, that swab cultures cannot diagnose. They do not quantitatively measure bacterial levels in a wound. They can only culture out what's growing and tell you, here is all your species in the wound. So swab cultures have very little use in a diagnostic manner when you're trying to figure out how to treat. The definitive, considered still the gold standard, as you all know, is the tissue culture or the punch biopsy. However, in one of our previous interviews, we brought to you guys the PCR testing, polymerase chain reaction testing, which is a revolutionary new technology as well too in diagnosing specific bacterial strains, and that may be something to consider as an option better than just a standard swab out there. So, and if you want more information on that, check out our list of videos on our YouTube channel, Wound Care Gurus, or our Facebook page. They are available for you to go back and watch those if you want to learn more about that. So moving on, my next question then is, because this
Bill, if I could actually hop on after that question about swabbing, because I absolutely agree with you that a biopsy is going to give you far better information than a swab. But what you see when you look at the fluorescence images is often that center of the wound area that people take a Levine swab from, or people take a biopsy from. Often that's not the part of the wound that contains the bacteria. So you might be sampling, taking a biopsy and all of the time and challenges that might cause for the patient, and you're taking it in the wrong location.
Right.
So if you are going to sample a wound, sample it under fluorescence guidance. When you sample in a region of red or cyan fluorescence, you know that it's a true positive microbiology result come back from the lab. And there won't be any of those wasted costs because the sample has come from the wrong location.
Right.
Our studies have also shown that if you sample in a region of fluorescence, you're much more likely to detect additional bacterial species and much higher bacterial. So it's more useful information for you.
Good. Excellent. No, that was a great point. Thank you for throwing that clarification in on that. And I would also say that we should be limiting our punch biopsies to wounds that have multiple signs and symptoms of an infection. Whereas MoleciLight can, if I understand, can be used when the bacteria are at a level they're probably starting to inhibit healing, but there may not be a whole lot of symptoms being manifested yet at this point. But they are still providing a inhibitory factor or barrier to healing. So you can start early removing bacteria where maybe you, if you aggressively treat or manage the wound with proper cleansing or antimicrobial agents, you prevent the wound from ever moving into a symptomatic infected wound. Does that make sense?
Absolutely, absolutely. So this is all about earlier detection of bacterial loads. Now, many of the wounds might come in and they're already infected. And in that case, the bacterial fluorescence will at least tell you where to target your treatment, where to target your sampling. But the true goal here is to catch the wounds earlier before they head through that infection cascade. We want to limit antibiotic overusage. We want to limit all of these unnecessary procedures. We want to get these wounds early and get them healed.
Awesome. Now I'm going to throw one more question that came up that I think is kind of related to where we're at right now, and that is, does the body temperature cause any abnormal readings with this particular device?
Oh, that's a great question. No, it doesn't. The body temperature doesn't change the colors that are seen on the device. So tissues with the device generally fluoresce a green color. That's coming from the matrix components, collagens, elastins, fibrins. They're all contributing to that green color. That won't change at all with the temperature in or around the wound.
Okay, excellent, excellent. We have another question from Rob. Rob, I'm not forgetting you, but we're going to be getting to some of that, and I think she's going to answer it as we get ahead in some of our other questions. So here's my next question for you, Monique, because I'm sure this is a big one, and that is because it's kind of a hot topic in wound care, and that is biofilm. And does the MoleciLight, is it able to detect biofilm?
Yeah, that's a fantastic question, and it's such an important question that we partnered with a university in Texas, Texas Tech University, because they're really a biofilm powerhouse. They have a lot of in vitro and in vivo models that are well established, and they've used for years to look specifically at wound biofilm. And so we partnered with them, and we were very pleased through those studies to have produced definitive evidence that bacteria in a biofilm does still fluoresce red, and that red is detectable with the MoleciLight device.
Okay.
Now, it doesn't distinguish a biofilm.
Right. Okay.
So this will fluoresce red whether it's planktonic or whether it's biofilm, but it can direct you to where to target your treatments.
Right.
And I know that for clinicians who are listening, they want to mechanically disrupt that biofilm, and so this can lead you to those regions.
Excellent. Good point. All right. So while we're on that, because you were just talking about some of those studies, how about can you describe some of the most compelling studies and findings that you guys have seen?
Yeah, absolutely. So we've recently completed a 350 patient trial across the United States. That was done by 20 clinicians, 14 sites. And the goal of that trial was to compare clinical signs and symptoms. So your standard redness, friable tissue, odor, all of the classic clinical signs and symptoms,
Sure.
which are used on a daily basis to detect high bacterial loads in a wound, even though technically they're symptoms of infection. And we compared the sensitivity of clinical signs and symptoms with the sensitivity of the device for detecting high bacterial loads, specifically a 10 to the 4 CFU per gram. And what we found across all those sites and across all wound types, DFUs, venous leg ulcers, surgical sites, pressure ulcers, we found that the sensitivity, and the number of wounds that we were flagging with MoleciLight was over 3 times as high.
Oh, wow.
So a threefold, 300% increased sensitivity compared to your standard clinical signs and symptoms. And what was really encouraging in that particular study is that the clinicians had to write out a complete treatment plan based on clinical signs and symptoms.
Sure.
Sign that off, set it aside, and then they were handed the MoleciLight device. And after MoleciLight, they wrote out another treatment plan. So we were able to see the clear differences in treatment planning coming from this information. And across those 20 clinicians, we were seeing that they were changing their debridement over half of the time in their wound. They were changing where they sampled over 40% of the time. They were changing their wound bed preparation 90% of the time based on the fluorescence information. So it was really making them completely rethink what's happening in this wound that I'm looking at.
Right. Okay. Excellent. Oh, again, that is amazing information, and obviously, anything that guides better and more efficient and effective treatment is vital to good 21st century wound care, as we were talking before we came online. So, next question is what types of clinicians can actually use this device?
Yeah, so any clinician who is certified in wound care can use the device. The device is quite it's simple to use. The clinicians need to become familiar with how to interpret the images. Image interpretation is very important. You need to understand what is normal tissue, healthy tissue, versus what are the signals coming from bacteria. MoleciLight has many resources available to help clinicians with that, including application specialists, online resources, e-learning modules, etc. So clinicians need to become trained on how to interpret the images, but once they're comfortable with that, they can start using the device right away on their patient.
Is
So
there any limitation to how often that you can fluoresce a wound?
Oh, that's a great question, Bill. So the device uses safe violet light, and it's violet, not ultraviolet. So it's entirely safe, and that means that there's no limitation on how long you can expose a wound to that light.
Oh, okay.
You can do your debridement under fluorescence, keep that wound under the light for as long as you need to, and then how frequently you would image a wound is really based on the medical necessity for that particular patient. If you're really struggling to get the bacteria under control, then maybe you might image them, say, 2 times a week. If this is a wound where you're not really concerned about the bacterial burden, maybe it's every 2 weeks or less. It's whatever the clinician deems is necessary to check in on the bacterial status of the wound.
Okay, excellent, good. Well, that's good to know. So there, you can wand away with this bad boy, and no deleterious effects will be seen by the patient. So, let me just add to that. What other aspects of care can be benefited from the bacterial imaging besides what we've kind of already discussed? Is there anything else?
What aspects of care can be benefited? So we've talked about wound bed preparation. That's very vital to make sure that wound is clear of as much bacteria as possible, to give any antimicrobial product that a clinician might be choosing to use their best chance of working.
Sure.
Another aspect of care that's really being impacted is the use of advanced therapies like cellular tissue products or skin grafts. So those therapies are well known to be contraindicated for high bacterial loads. In fact, clinicians need to document in their notes that they have ensured that the wound is free of high bacterial loads before applying those products.
Right.
And so the reason for that is because if you apply them and there's high bacterial loads, they have a higher chance of failure. And failure rates on these products are higher than we all would like them to be, because they're excellent products when used appropriately.
Sure.
Right? So what clinicians are reporting is that they're using this to do their wound bed preparation and make sure that wound is fully ready before they put on that cellular tissue product. And actually, if we could put up the skin graft slide there, I'll show you what it looks like when a skin graft fails. So here's an example of a wound that the clinician deemed was ready to put on a skin graft onto a skin graft product, and you can see the red fluorescence all through that graft that is actively failing and coming off of that wound. So if you can ensure that the wound is better prepped before you apply these products, they should have a higher chance
Oh, I lost you.
Oh, I'm still here.
Oh, okay, you're back. Something happened, just the audio went out. So back up about 10 seconds and start again.
Okay, okay. So if you can, so this is an example where you can see the red fluorescence throughout this failing skin graft. And if the clinician had known that there were high bacterial loads before applying this product, perhaps they could have delayed, or perhaps they could have done better wound bed preparation right there, right then and there, in the office or in the OR setting before this is applied, and clean up all that bacteria before you put the graft on, and give it its best chance of success.
Excellent, excellent. I'm going to bring that back down from there. So now to the next big question, because I know that everybody wants to know this one, and that is there reimbursement available for procedures performed with the MoleciLight?
So I'm very excited to be able to say that there is. Our reimbursement code went live on July 1st. So this is brand new news. So as of July 1st or last week, there are two CPT codes available to cover physician work using the device. And then one of those codes also mapped to an APC assignment for a facility payment in the hospital outpatient department. And that also extends to the ambulatory surgical center as well. The device has also been awarded 4 new ICD-10 procedural codes. So the reimbursement for this device is coming on board, and both the CPT codes and the APC assignment both went live on July.
Excellent, excellent. That is good to know. So July 1st, this is actually going to get you paid, which is always good. You know, nothing better than getting a little money for what we're doing. That's what we do. It's not supposed to be just giving away everything for free. So reimbursement is a huge thing because a lot of clinicians, I mean, have to make a decision sometimes on what they can or cannot do based on is it going to get covered or not. So that is excellent news. Excellent.
It's excellent, and it's my hope that these codes will make the procedure more available to the patients that need it, where otherwise there wouldn't have been funds available to cover the patients receiving the procedure, because so many patients are struggling with high bacterial loads, and it's often asymptomatic, lurking in regions of the wounds that you wouldn't think it is, and it needs to be addressed.
Oh, excellent, excellent. So, are there any particular settings where you see this device being best used in?
Best used. Oh my. So you can use the device across many settings. One of the newly or maybe enhanced popularity settings for using the device is in the home. Now that we're all dealing with COVID, and we're all in our home. I'm in my home right now. My son's coming in and blinding me. So because the device is handheld, it's portable, clinicians can take it into the home care setting. This can be done in a physician's office setting. This can be done in a hospital outpatient department setting, in the emergency room. It really, the site of service can vary widely, but since we're all navigating this new way of doing medicine, both home care and then also telemedicine have been coming online as very popular ways in which the device can be used.
Excellent. I would see where it would probably work really well with telemedicine and be a great synergistic tool to be able to use with that. So
yeah, and the device has the capability to do some mirroring. So someone the clinician back in the office can be looking at these images immediately and interpreting them from a distance. I'll also add that the device can be used in the OR setting, and it does have a surgical sleeve available that it can be slid into, so it can go into the OR. It can be used in places where either like in the OR, everything needs to be sterile, or it can also be taken into things like patients with COVID or MRSA, these types of challenging places where everything needs to
Right.
be a bit more sterile, surgical sleeves available.
Oh, excellent. That's a nice little adjunct to have on there. So, um, is there any particular reason, again, I know you may have touched on it a little bit, but um, is there any particular thing that would, where a wound center or home health agency, why they would consider adopting this? How would that, in those particular areas, make their care better?
In a wound care center, so if you look at our clinical trial results or even some of the real world evidence, we're seeing that the median bacterial load in your average wound care patient in the United States is 10 to the 6 CFU per kg. That's an astounding bacterial load to be the average bacterial. So, this goes to show that wound bacteria is prevalent in most of the patients that are coming through a wound center. And one of the reasons that patients come back to a wound center over and over and over again, because their wounds just aren't healing, they're stalling out.
Right.
You're getting frustrated. I've tried 4 different treatment plans, nothing seems to be working with the wound. And often it's just that, if you've checked vascularity, you've checked all the other features, maybe it is a bacterial problem, even if that wound has no symptoms whatsoever.
Right.
Many of these chronic wound patients don't have the system to mount a true immune response that has these classic symptoms. And so the bacteria can go hidden for very long periods of time. So a wound care center will see that they're catching more of these wounds early. They can be more aggressive with their cleansing, with their debridement, and they can frequently assess the treatment efficacy of what they're doing. Did I clean it well? Maybe not. Did I? Often not. Are the products that I'm using working? My cleanser any good? Or maybe it works on that patient, but it doesn't work on this patient, and I need to reach for something different on this patient. Do I need to debride a little deeper? Did I miss a region that I should have debrided in the first place? So all of these decisions can happen in real time, like at the patient's bedside, so that when that patient gets, their dressing put on that day, they're going home with their wound in as good as it could be based on objective information.
Right. That's incredible. I'm just thinking of my own, back in the day when I was practicing regularly as a wound clinician. That would have been an awesome tool to have when I was debriding wounds and or treating wounds that I had a suspected bioburden. And I've said this many times when I teach different wound care seminars and the conferences and stuff and courses that I teach. I think in general that clinicians have become a little bit too timid when they clean wounds nowadays because they're just too afraid to hurt the wound. So they get too gentle. They don't put a little elbow grease into it. And I think a lot of the reasons why we're seeing these chronic biofilms and these high levels of bacteria that you mentioned is because we're just not even doing a good job with a basic cleaning with some gauze and saline and just, because we're just like, oh, I don't want to hurt anything. And so we just kind of gently, and I'm like, yeah, that ain't getting the job done. And now you can see.
That's not going to get the job done. It's really not. I heard someone today say, clean it like you mean it. And I think that's great. That clinician was very on point when she said that. And also, many sites cleanse with saline regularly. I've seen thousands of wounds undergo cleansing, and have seen the before and after images. Cleansing with saline is not getting it done.
Not getting it done
it's
in
not.
Cases.
And every patient needs their own patient-specific treatment plan.
Right.
But in general, gauze and saline with a little, a light dabbing, it's not the way to go.
Awesome. I'm going to steal that little quote from you on my class I'm teaching next week for WCEI in Virginia. Clean it like you mean it. I'll give you
Well, I
credit
stole
the
it from
first. I'll
someone
give you
else
credit the
again.
first time, Monique. After that, it's mine. So it's kind of like drive it like you stole it. So, but anyways, but thank you. That's a great point to make. So, one last question that I have for you, and that is, and I think you touched on it earlier, but about the interpretation of the fluorescence. How difficult is it to learn that so you can differentiate?
So it's I guess it's simple and it's difficult all in one. So the red fluorescence is pretty easy to identify. You saw those images that went up earlier. The red, pink, orange, all of that's in the category of red fluorescence,
Mhm.
and it's pretty easy to identify that on the images. And we train clinicians to know that. When the red fluorescence is more faint, like a pink or a blush color, then that's probably subsurface. And
Okay.
as you debride that tissue away, the red becomes more and more prominent. What has more of a learning curve is Pseudomonas. So can you put up the slide measurement
Yep.
on
I
measurement there?
see that one. Yep.
Nice image of Pseudomonas there. So here you see a wound. It's had wound stickers applied on either side of the wound. These are MoleciLight wound stickers. And then you can see this is undergoing the digital wound measurement feature. So the stickers turn blue under the device on the device screen when they've been detected, and then the wound borders automatically detect and give you an area measurement that you see at the top. It also reports length, width, and then you can manually input a depth. But I brought this up for the image on the right, where you can see that the healthy tissues in the foot are a dullish green color, and then up in the top corner of the wound, you see that bright cyan color appearing there. It looks very artificial. It looks very distinct from the colors in the rest of the foot, and that's that classic signal from Pseudomonas. And it's got more of a learning curve for clinicians being able to readily pick up on it and feel confident about it. But like I said, we have many training resources available. And after clinicians have been using this for a couple of weeks, they get very comfortable with interpreting the images.
Excellent, excellent, good, good, good. And we got a couple of questions. One I'm actually going to handle because it's a product question that from Lanny asked if it's okay to use betadine on the peri-wound preparation, and betadine is approved for use on skin. So as a peri-wound antiseptic agent, betadine is perfectly safe to do that. Although we should not be using it in the actual open wound because it does not have approval here, at least in the States. For use in any type of wounds. It's for first aid, antisepsis, and skin preparation. Now, for you, I got a question here, Monique, and it says, do you buy this bad boy? I'm just adding that in, or do you rent it?
So the device can be purchased outright, or there's also leasing models available. So it can be purchased or leased.
Excellent. So you have some options there. So
There are some options
all
there.
right, terrific, terrific. I'm thinking we got most of the questions done that we had on our original list. Just I'm going to give my audience a chance. If anyone wants to throw in any last minute questions as we kind of wind things down. I want to just give you the chance, Monique, before I'm going to put up your contact information. But is there any last things you want to share with the audience that we didn't cover tonight that you think would be pertinent and helpful to them to know about MoleciLight?
I think just remembering that this is information at the point of care on bacteria, and keeping in mind that it's non-invasive, so this can be used across all your patients, across all your care settings, and really, if I could just drill home how much of a challenge bacteria truly is in wounds. I know that all clinicians know that all wound clinicians know that they struggle with wound bacteria on a daily basis. You're all in the trenches trying to deal with bacteria and get it out of the wounds. But the clinical studies and trials from MoleciLight and many other groups are showing that wound bacterial burden it exceeds what is commonly assumed in wounds. I don't I don't think it's a coincidence that it's something that we haven't been able to diagnose prior to MoleciLight, at least not at the point of care,
Sure.
with an imaging technology.
Mm-hmm.
I think there's a strong relationship between that and the lack of improvement in healing rates over these past decades. So there have been studies with MoleciLight that demonstrate if you target the regions of bacterial fluorescence aggressively, that there is an acceleration in the wound healing. And ultimately, that's what it's all about. We all want wounds to be healed.
Sure. All right. Cool. We have a couple more things that popped up. A friend, a colleague of mine, I think he was my student, Jose, from wants to know: is this available in Puerto Rico?
Ooh,
Ooh, we might have stumped her, Jose.
yeah, I think you stumped me on that one. You stumped me on that one. That one I don't actually know the answer to. So there is, Bill will put up the contact information at the end. It's info@MoleciLight.com, and we'll direct that to someone who knows the specifics of that better than I.
And as predicted, Monique, we did get the question: what is the cost?
Yeah. So knowing that you have listeners coming in from various jurisdictions, the cost, of course, varies by jurisdiction. So I'd encourage people to reach out to the information line, and we can get you the appropriate information for your jurisdiction on the cost of the device.
Excellent. And we're going to have you just do a quick repeat. One of the gals said it kind of cut out when you were talking about cleaning wounds with saline, and she would like you to kind of just repeat that or just summarize what you said about that and what you.
Oh, I said it's not doing a lot. Saline isn't really getting the job done. I don't want to say that it's not removing anything. Of course, it's
Sure.
removing some of the bacteria from the wounds. But typically, the many of the wound cleanser sprays and other products on the market do a far superior job to saline.
Excellent.
And I have some information coming in. Yes, the device is available in Puerto Rico.
Ah, excellent. Rob has clarified that for us. Good to see you, Rob. I'm glad you could join us tonight. So I don't see any other questions. So what I'm going to do is just pop up the contact information. You can kind of go over it with the audience as we kind of bring this to a close here. So I'm going to pop that up. There we go.
Yeah, so thanks so much to everyone for your time. If anyone does have questions, they can reach out to info@MoleciLight.com. If the question's specifically for me and you just want to mention that this is something that you saw on Wound Care Gurus and you had a question, that line can direct it into me, or it can direct it to the sales team or wherever it needs to go. And you can also visit MoleciLight.com. And for any information about reimbursement, there's also us.molecilight.com/reimbursement. We'll give you the information about that.
Excellent. So I'm going to leave this up just for another second here, everybody. Anybody wants to take a screenshot of this quick? Otherwise, you'll have to go back and watch the video again if you didn't write this down. So anybody wants a quick shot of this, so you've got a quick reference for their contact information, take your screenshots now. And with that, Monique, I want to just say thank you so much for this evening. You've done a spectacular job of answering questions and sharing the product MoleciLight with our audience. So again, I want to just thank you. I was honored to be able to interview you and hear what you had to say about this. This was, like, as I mentioned in our kind of pre-Facebook Live talking as we were getting ready, that I didn't know very much about MoleciLight. I mean, I was familiar with it and I kind of understood what it does, but I learned a ton tonight, and I know that our audience is really appreciative of this, and you taking the time to be able to be with us and sharing that information. So thank you again for taking the time to be with us tonight.
Oh, thanks to you, Bill, and thanks so much for the opportunity to share this with you and your audience. It was a pleasure.
All right. Well, you take care, Monique, and we will talk to you again, I'm sure.
Okay. Bye, everyone.
All right, folks. That brings us to a wrap here for tonight's Wound Care Gurus Facebook Live. My wife says, hey, she was unable to be here tonight and be with us, but she misses everybody. But we just want to let everybody know. And This Nancy, great. Yes, I know, big buzz report. So I hope that we can use a lot of this information. So with that being said, everybody, I am going to sign off for this evening, and we will see you next time here on Wound Care Gurus.